Good afternoon, everyone. My name is Brett Moore. I'm the co-lead of the Global Shelter Cluster, and on behalf of the Global Shelter Cluster and my co-lead, Ella, I really welcome everyone here today. This session, normally we are face-to-face, but of course with COVID and with other restrictions, we are now connected from various places around the world. This is the third year in a row where we've had this Ignite session, and this session actually is one of the highlights of our Global Shelter Cluster meeting. We started this session a couple of years ago when we decided that it was much more valuable to begin some work around exposing our shelter partners to other kinds of thinking, innovations in the humanitarian system, changes in conceptual direction, and since then we've had really good feedback. And really to help pursue the theme of this year's event, which is the impact of shelter and settlement, we're reaching out broadly and looking at themes around the challenges and the exciting ways of finding and findings from partners that we have around the world, partners from academia, from the humanitarian system, from government, from the private sector. And this provides really broad perspectives and help us develop evidence and data, to really get some improved humanitarian outcomes and not work in so much of a siloed approach. So in the session today, we have 4 speakers, and we'll highlight how really the range of impacts of broad-based and effective shelter and settlement programs and how they can get some great results. For example, on the health side, I think it's been well known for many years the relationship between one's living conditions and their health outcomes. And we look at a lot of recent academic data that's been established. We've done research with our cluster partners and looking at these extraordinary outcomes now that are really there as evidence of the role of the built environment and the determinant that the built environment has on physical and mental health. Even in terms of livelihoods, it's now reasonably well known that shelter projects, building a home, can help create 5 jobs and 8 indirect jobs. And when you think about it, really, housing and shelter, the purchase of or rental of, is one of the biggest expenses faced by families and individuals. So there's an inextricable link between livelihoods and housing. Education, good data now shows that children who are living in families that live in adequate shelter and further than that receive shelter early in a humanitarian response have much higher literacy rates and education participation than children that live in inadequate shelter conditions. Even in terms of protection, GBV, gender-based violence. So those people that live in adequate shelter have a much lower incidence of domestic violence and much higher mental health outcomes, including fewer doctors' visits. And even when you think of one of the biggest and most pressing issues that we're all facing at the moment, and that is the environment, at household level, when you think about it, housing has the biggest impact on reducing carbon footprint, because really the design, construction, and material choices of one's dwelling consumes a vast amount of energy. And when you think of energy consumption of an individual or at a family, it's heating, cooking, lighting. This is where it all takes place. So really within this session, we're looking at these broad-based issues that come out of effective housing, shelter, settlement programs. Now, to help us through this discussion today, we have 4 wonderful speakers, all coming from different parts of the world and representing different experiences, different opinions, and have a different voice. So for our 4 speakers, we will go through, and each of the 4 speakers will speak for around 5 minutes and discuss the issues from their perspective. It'll be a discussion. We'll pose a couple of questions to each of the 4 speakers, and then we'll open up for discussion from the floor. So that's how we'll proceed. And without further ado, I'd like to go through the 4 speakers, introduce them, and you can get to know them a little bit, and then we'll get each of the four speakers to begin. So our first speaker today is Ms. Linda Dool, who is the head of the Global Health Cluster since 2014. Linda has more than 25 years of experience in international health and humanitarian sector, worked in a range of organisations, including medical aid for Palestinians and a range of countries throughout Africa and the Middle East. Linda was also working as a health advisor initially with Merlin, UK Merlin, and was their Director of Health Policy up until 2014 before she joined the cluster. Now, of course, there's a range of issues that we're looking at in terms of COVID-19, and Linda will no doubt speak on that and the wider relationship between health and housing. The second speaker that we have today is Karima Benbi, who joins us from the World Bank. Karima is an urban and DRM specialist, and she's based in Washington. Karima I've been working quite closely with remotely while I'm here in Beirut. And Karima works in the Middle East and North Africa team, and she has an emphasis on recovery and reconstruction. She'll be speaking from this perspective and really the relationship between humanitarian approaches and development outcomes. And she's well versed in these issues, coming from a background in urban planning and disaster risk management and holding a PhD in architecture and urban studies. Karima has also had a lot of field work with a range of different international NGOs and organisations. And our third speaker today is our esteemed speaker, Congresswoman Ramirez Sato from the Philippines. Congresswoman Sato has had a distinguished career in the Philippine government. Now she's the Congresswoman of Occidental Mindoro in the Philippines and has been from 2013. She's held previous posts as Vice Governor and Governor for two full terms from 92 to 2001 and 2004 to 2013. Congresswoman Sato also has a wide role in various civil society groups and takes on a lot of these issues around disaster preparedness and response, and really reflects this in her personal advocacy. She's also currently chairman of the board of directors for the Philippines Red Cross for the Occidental Mindoro chapter. And she's also actively involved in a range of other pursuits, including as the chairperson of the Girl Scouts of Mindoro chapter. And she's also recognised for her work in sustainability and biodiversity, and is a legislative champion of the United Nations Biodiversity Finance for the Philippines. So we welcome her very much, and also look forward to Congresswoman's comments on the relationship of these kinds of issues to the Philippines around effective disaster response. We know that Philippines unfortunately does encounter a lot of natural disasters every year, but has a very well developed governmental and civil society response. So we'll have some valuable words from the Congresswoman, no doubt. And last but not least, our final speaker is Saeed Amar. And now Saeed joins us from the field. He currently works for the Watan Foundation, and he's based in Gaziantep, but he himself is displaced from northwest Syria and routinely goes back and forth to northwest Syria in his current role as shelter and NFI project manager for the Watan Foundation. He's been in that role since April 2018, and he also works on program development and project management related aspects, so also including camp planning and also the winterization response, which, as we know, in that part of the world, in northwest Syria, especially last year, was a very brutal winter where there was a lot of suffering. So Saeed will speak really on reflecting some on-the-ground considerations and what he's witnessing there, what people need, what is an effective response, and how we can look more at localization and what national NGOs are really looking for and wanting from future humanitarian processes. So without further ado, I will now hand over to Linda from the Global Health Cluster for her opening remarks. So thank you very much, Linda. Please proceed.
Many thanks, Brett, and thanks to all Shelter colleagues and partners for the opportunity to join your discussion this afternoon. So as Brett alluded to in his opening remarks, the quality of shelter and housing has a major implication for people's health. Improved shelter conditions, I mean, it can save lives, it can reduce disease, increase the quality of one's life, help mitigate the impact of climate change, particularly around the sort of wild temperatures swings we're seeing nowadays, and overall really contribute to the achievement of the Sustainable Development Goals. And from my perspective, SDG 3 around the whole issue of good health and well-being. So essentially, not only is health as a human right, but housing as a social determinant, as a key social determinant in achieving that right and assuming good health. And as such, housing and shelter should be considered a kind of major entry point for any public health programme and a primary prevention. And how does it do that? Well, as Brett also said, shelter protects against health threats, be that disease or some of the challenges around gender-based violence. But it's also a location where health services can be accessed, particularly in the humanitarian setting where health systems are often quite weak and populations very remote. Much of the healthcare is provided at a community and home-based care level. But poor housing, as we know, can also expose people to health risks. So overcrowded or crowded households clearly increases as the exposure to various infectious diseases, has a major impact on mental health and adds to increased stress. Inadequate wash and hygiene facilities obviously increase the risk of communicable disease. The indoor pollution, as Brett suggested or talked about, also is clearly linked to non-communicable disease and the major impact of both cardio and respiratory conditions. And that's as much in the context that we work in low resource settings that actually have some of the highest incidence of non-communicable disease. As we know, structurally deficient housing can cause risk of injury, and many of the populations that we work in are living in very informal settings or housing with poor building regulations. And poor accessibility of any shelter or housing clearly has an impact on both the physical and mental well-being of disabled and older people, causing potentially injury, stress and isolation. And we've seen this in many of the crises that we've all worked in over the years. So the question is to be, how do we as health and how do we as the cluster, shelter cluster, address this issue? And it was interesting going through the shelter cluster strategy, where there's a very clear statement where it says that it's imperative both to build evidence around the critical role shelter plays in health protection, livelihoods, education, psychosocial support, which clearly indicates this as shelter is a multi-sectoral issue, but it also says that there's limited evidence on many of these multi-sectoral aspects. And I think from that perspective, the WHO Housing and Health Guidelines published in 2018 goes some way to fill that gap, or at least guide us in our conversations around that evidence base and some of the practical solutions and recommendations on various conditions and interventions that promote both healthy housing and reduce the burden of disease. So I was reading both shelter cluster strategy, the WHO guidance, and obviously looking at the health cluster strategy around, which also promotes intersectoral coordination. And it begs the question, are we doing enough together as two key sectors, as we both agree that shelter has a major impact on health, and that as a health sector we are very reliant on effective housing, shelter and settlement. Are we doing enough? Are we making enough opportunity and making the most of opportunities to ensure that shelter effectively safeguards health and achieves improved health outcomes? And if I'm being perfectly honest, I think the answer has to be no, we're not doing enough. That doesn't mean we're not doing anything. The question is, are we sufficiently aware of the examples of good practice and everything we have already in the many humanitarian contexts that we work in, and how can we capitalise these? And in some ways, I think COVID, for all its challenge, has actually acted as a very useful catalyst for the conversation between shelter and health, as particularly as a respiratory disease, a respiratory pathogen, which we're not terribly used to in a humanitarian context. It's not the main type of pathogen we deal with in this kind of scale and severity, but it has absolutely highlighted the interface and the synergy between the need for effective shelter housing, both to protect a vulnerable population, but also to provide services and to be able to safely isolate or quarantine individuals with COVID. And I'm happy to say a bit more about that as we move into some of the questioning. But so for me, this is a great conversation to have now. The synergy is clearly there, but I think we have a lot of work to do to better understand each other and some of the good examples that we have already on how shelter and the health cluster work together, and really find a way forward and how we can further strengthen this collaboration. Thanks.
Thank you very much, Linda. I think you've really established that some of the connections, and look forward to the conversation follow up after we've had our speakers. Next speaker we have is Karima. So over to you, Karima. Thanks very much.
Thank you, Brett, and hi everybody. Can you all hear me well? I've been having a lot of connection issues these days.
We can.
Thank you. Thanks.
Quite good.
Okay, so hi everyone. My name is Karima Benbi. As Brett mentioned, I've been working closely with Brett over the past couple of weeks, which has been a great pleasure. I work for the World Bank, and as you all know, the World Bank is an international organization that focuses on development. So we often do not engage immediately in the humanitarian space. And obviously our mandate and engagement with the stakeholders is a bit different. We tend to deal with governments. We support the public sector to ensure that sustainable development is achieved and that poverty is on track to be eradicated. We do, however, engage in recovery and reconstruction post-disasters. Usually housing is generally the sector that has been the most damaged and necessitating the most support, which brings us to rethink a little bit our engagement as a development agency on how and what would be the modalities by which we are better efficient to support both the governments in helping the households recover in a sustainable manner. So from the development side, generally, housing is extremely difficult to address because we generally think of the public sector as an enabler. And we try to support into creating this environment that is enabling for formal access to housing tenure, be it rental, be it home ownership, or any other form that might be existing in the countries that we work with. However, after disasters or conflict, this housing becomes more than just a private good, right? It becomes a social good where we, as the World Bank, where we can only intervene to allow private citizens to buy or rent houses, it becomes something upon which hinges the recovery of the society and the economy. And so we do need to rethink our engagement in this enabling environment in such exceptional situations, and try to support the governments in supporting the households and that need to rebuild their homes and lives. Now, whose houses have been destroyed and who needs help, who most needs help to access inadequate and sustainable housing solutions becomes a very complex question. Where do we start and how do we intervene as shelter actors has ripple effects on the long term that goes way beyond just the recovery phase into some practices that will have potential damaging effects on the sector as a whole. And so we need to think very, very carefully about some of the practices that we use as developmental actors in the reconstruction, working together with the humanitarian actors into what that means in the longer term. So, for example, do we provide cash subsidies for all homeowners to repair their homes? And then, if so, what do we do about the renters in the meantime? Once we work with renters on rental subsidies, what would be the long-term solution for these renters to really be able to sustainably be able to afford these homes that we were able to support on? What do we do about urban areas, which are extremely complicated, that add this complexity of the housing sector and multiply it tenfold? And what would be the implications of all of these items on the housing markets, on the land use and the land cover, on the real estate, but also on the policies that will be governing the sector and governing the countries for decades to forward. So in the most recent case of Beirut, I think the collaboration between the humanitarian and the development agencies has really been a great example into thinking about how, in leading a rapid damage and needs assessment ensuing the explosion, and then a recovery and reconstruction framework that followed it, and how we as both humanitarian came together trying to think about what would be the specific actions that are needed now, what we call the no regret measures, and what would be activities and actions that we would build on them that are more on the developmental side, but that need to be seeded in the early stages of early recovery. And so thinking through this appropriate sequencing that truly benefits the most vulnerable and ensures the recovery as a whole that is going in a sustainable manner has been one of the great learnings from this experience. And we're hoping that this framework that we have brought together with UNHCR and with UN Habitat will be sort of a roadmap for all of the actors, humanitarian and development alike, that they will be following forward. We've had very good collaboration examples as well in Iraq's housing post the conflict with ISIS, with the shelter cluster, with UNHCR, with UNDP, trying to build on the activities that they are doing on the ground from our perspective as development actors, and building on those at the governmental level, both at the governorate and the national level, and building on these activities into trying to formalize the reconstruction processes, ensuring that there is a blanket support to everybody. That's something that could be more than just regional, and so I think that one of the elements that really are necessary moving forward is really continuing this humanitarian development collaboration, particularly in the case of housing, because of the ripple effects and the impacts of this intervention beyond the humanitarian sector. With that, I'm going to stop, and I'd be happy to follow on later. Thank you.
Thank you, Karima. That was lovely, wonderful start, and I think you really mapped out the issues there around this humanitarian development cooperation. No doubt there'll be many more questions coming up after that. For the next speaker, I'm very pleased to introduce Congresswoman Ramirez Sato to give her opening remarks. Thank you, Congresswoman.
Thank you. Greetings from the island province of Occidental Mindoro, Philippines. Apart from the unfortunate and dire situation that it brings to peoples, families, and communities, disasters are continuing wake-up calls that provide us with opportunities to rethink and re-engineer our disaster risk management strategies and shelter assistance efforts. Let me share with you our experience in the province of Occidental Mindoro. The Philippines can claim to hold the record of having the longest Christmas season in the world. Christmas season starts September 1 and ends on the first Sunday of January. We were in the midst of Christmas holidays when on December 2, 2019, Typhoon Tisoy hit Occidental Mindoro. It devastated the northern part of the province. Many were rendered homeless and were brought to evacuation centers and schools, which served as their temporary shelter. Then, with barely time to rest, on Christmas Day, Ursula, another Category 4 storm, hit this time the southern part of my province. The Department of Social Welfare and Development reported that for both typhoons, 15,645 houses were damaged, with 10,719 houses totally destroyed. Immediate relief operations were conducted by our office the local government units, national government agencies, Philippine Red Cross, and other civic organizations. Simultaneously, clearing operations of highways, roads, and bridges were done by the Department of Public Works and Highways, assisted by the Philippine National Police and the Philippine Army, so that the responders and rescuers could reach the devastated areas. We distributed hot meals, food packs, and relief goods. Cash assistance were extended to the severely affected. We also distributed medianoche packages, which included the usual fare for New Year's Eve dinner, such as bread, spaghetti, noodles, fruits, and drinks. Medianoche is a Filipino tradition where the family gathers together for a special meal to welcome the new year. We wanted affected families to be able to celebrate the new year, even in a very simple manner, despite the devastation of the typhoons. As part of the disaster recovery and rehabilitation efforts of the national government, my congressional office and the local governments of affected municipalities, the Department of Social Welfare and Development implemented the 250 million pesos emergency shelter assistance and the Cash for Work projects for 7,000 families whose houses were totally damaged by the two typhoons. We started this in February of this year, and we expect to complete this before the end of the year. Also, in February of 2020, a partnership was forged by and among the local government units of affected municipalities, the International Federation of Red Cross, the Red Crescent Societies, and the Typhoon Ursula affected communities. With the funding assistance of 20 million, a recovery program was launched and implemented with the following components: household livelihood assistance, full shelter assistance, and community-managed livelihood projects. Let me emphasize at this juncture that the International Federation of Red Cross Shelter Cluster Philippine Initiative is notable and commendable on several aspects. One, in terms of timeliness and appropriateness. The response has been very quick. The project began in February 2020, barely 1.5 months after the two typhoons. Its implementation, while slightly adjusted, has not been deterred by the COVID-19 pandemic. While the local government focused on relief operations, the IFRC project focused on rehabilitation and recovery. Secondly, the IFRC project is partnership-based. Relevant stakeholders, such as local governments, national government agencies, and community-based organizations, have been mobilized to become partners, each playing distinct but contributory roles. Like in one municipality, since the affected families live in an area identified and declared as danger zone, the local government unit purchased a parcel of land to serve as a relocation site. The national government, for its part, facilitated the release of permits and licenses. And of course, the IFRC provided the funds for the construction of houses. This project has brought to our people, one, the warmth of a safer and comfortable homes. It built confidence in our people to start a new life because of the assistance given to them to engage in livelihood projects which they themselves identified. It gave the people the feeling of protection because of microinsurance given to them. It also nurtured the feeling of living in a friendly and united community. because they were assisted to organize themselves into an association and given livelihood as such. As a policymaker, I am very much interested on how to mainstream and institutionalize these good practices in order to reinvent current programs and in order to maximize the use of public resources for shelter assistance in the face of ever-evolving disasters. As we face the serious challenge of building back for a better normal, I am reminded of an age-old tradition of the Filipinos, the bayanihan, which literally means the coming together of heroes. As a public servant, as a legislator, and also the provincial chairperson of the Philippine Red Cross, I have always advocated for the adoption of the bayanihan framework. With the root word bayani, which means hero, the bayanihan framework taps in the modern day, everyday heroes in each and every one of us. It calls upon us to come together and as a community, work in harmony with our goals. We are all heroes of our own time. And with this, I am more than certain that together we will overcome. Thank you and good day.
Thank you very much, Congresswoman Ramirez Sato. That was a really good explanation of the situation in the Philippines and the way that responses are handled there, setting the scene for the discussion. Our final speaker is Said Amar. So please, Said, we welcome you for your opening remarks.
Thank you very much, and thank you for the introduction. Said Ammar, and as you mentioned, I'm a Syrian displaced person before even I was a humanitarian worker, and now I'm a refugee in Turkey, living in Turkey and working on the Syrian response. If I may highlight on something on the while we was working on Syria since 7 years in 2013 with Syrian Arab Red Crescent, National Society was replying and supporting and meeting those people, those displaced people's needs. The biggest need was among those people within the Syrian context. The biggest need was shelter because millions of people was displaced from their own villages, from their own houses to another places and to another more secure places. Let me here highlight on something. The word shelter in Arabic means ma'wa, which means safety and security, especially for us as a humanitarian workers. Now we are working, and I'm working from Gaziantep towards the Syrian response. And this explanation of the word shelter make me a new obligation toward the beneficiaries and the people of concern. While, as mentioned, a million of them was displaced and million of them was moved from a place to another. We noticed something very important, that the biggest, supporter and seller for shelter, at least in Syrian context, and I believe it's also in many contexts, it is the people themselves. People are keep helping each other, sharing the resources with each other, and this is where our humanitarian work have to be pointed to support those affected societies, because mostly, when some people displaced from place to another place, there will be more density in population, there will be more lack of resources. How can we as local organizations meet that? It's the biggest challenge. Another thing I would like to mention here, like since 2013, while a lot of organizations and a lot of initiatives start to develop and start to reform, there is a big lack and there is a big gap of how to apply the humanitarian principles. We had a lot of trainings and meetings on how to meet donor regulation and meet another standards, but how to meet our people, how to meet the real affected societies with, let's say, actions that is in line with the humanitarian principles. You know, as I mentioned before, the shelter is the biggest need here in Syria, and yet we don't have any sustainable or any projects based on development. We are keep responding in emergency responses, distributing kits, distributing tents, and go back then to our houses. This is our main problem, and this is our main challenge. How can we support the infrastructure of those societies, those affected societies? How can we support those people to have secured monthly income, to have, as example, if we can mention, how can we design more durable shelter solutions? How can we provide cash-based interventions of shelter? How can we provide cash for shelter, as example? As Karima told us from the, now we are going to another phase of reconstruction and development, and yet the Syrian organizations, the local organizations, do not have the capacity to work in line with all the humanitarian principles, all the requirements. This is the biggest challenge that we are here facing it now, and just to meet the most affected groups, the affected societies. This is our basic rule as a humanitarian actor, and this is our biggest challenge. Thank you, and we can continue later on this discussion. Thank you very much.
Thank you, Said, for your opening remarks. I mean, really wonderful the work that you're heavily involved with there, and you've seen it all. You're a responder, you've been displaced yourself, you're a refugee, so you know the dimensions of your experience are very clear, and you know it's really great for us to hear from you and understand that you're really one of the people working on the ground, but also one of the recipients of our work in the past. So you've got a lot of perspective on that. Now, before we begin with some questions, I also want to encourage everybody online, everybody in the audience. I see that we have 40 or more people online, more than 50 people online. Think about how you're understanding this issue of the impact of shelter and settlement, and how our 4 speakers have responded to that idea. You're welcome to pose questions. You're welcome to put the questions in the chat box, and we will also be able to take some questions as well. We'll have one of our colleagues, I think it may be Miguel, moderating the chat box. But just to kick off some of the questions and deeper thinking discussion on this, I will propose a question to each of our panelists, and I'll read the question out, really, that we've prepared. So really, for Linda's presentation, you know, she really discussed the relationship between the quality of living conditions, one's housing and health outcomes, and the fact that COVID-19 has really shown us how important that is. We know that COVID and the living conditions of all people has been a key determinant, the density, the quality of living, the ability of people to meet their own hygiene needs. So there's some really key issues there. So Linda, really considering that COVID-19 is so linked to living conditions, and thinking about the ongoing pandemic response and the role of housing as a key determinant of risk around that, what lessons do you think have been learned? I mean, we've been collaborating over the past 7 months. You said a lot more still needs to be done. I completely agree with that. So I'd like to hear your thoughts on, do you have any indications at the moment which way the path is going and how some of these new collaborations could go? Certainly the way the cluster system is, we've had to really collaborate much more during this COVID-19 period than before. I'll leave that question with you and you can dwell on the answer, and then I'll come back to you in a moment, Linda. For Karima, really, you know, you were talking a lot about housing solutions, and when things start in a humanitarian response, that they really have a longer term outcome, and we have to be careful about what we do in the humanitarian response moment, because that will determine the path we're on during a longer term durable solutions phase. And we need to formalise a lot more around our reconstruction processes. So really there's a lot more that needs to be done around this humanitarian development cooperation. And knowing that we operate primarily in crisis and emergency contexts, and development actors like the bank, who you work with, really work in the recovery and reconstruction phase, which comes later. Exactly what do you think could be done to help bridge that gap? We know that the gap has to be bridged, but what, maybe 1 or 2 points, some key steps that we could make progress on for that? And I'll come back to you on that question. And for Congresswoman Ramirez Sato, thank you very much for your comments on the Philippines. And reflecting on your experience in disaster preparedness and response in the Philippines, and having local people engaged, there's a very developed context in the Philippines, supported by government. What has been your experience, and what lessons have you learned? What would you like to tell other people online, other colleagues, other people that are living in other countries that have joined us here today, about your experience in the Philippines from the perspective of government and working with local communities? What words of wisdom or key points would you like to give for our colleagues in Syria or in other parts of Asia, or in different African countries where we're also encountering crisis? So thank you, Congresswoman. I'd like to get back to your thoughts in a moment. And for our fourth speaker, Said, thanks very much. As we mentioned, you're a responder, you're displaced, and you're a refugee. You've seen it from all angles. You mentioned a few really interesting things there around the central role of housing and home. You mentioned about really complicated donor requirements and the challenges that national NGOs really have in responding to that. And the whole idea that we have to support the host community more in terms of infrastructure, because host communities are living in poor conditions themselves and also have to host really the burden of displaced populations. So I'd like to kind of look a little bit at that issue that you raised. So moving toward the role of local agencies, there's a lot of discussion at kind of Geneva level, headquarters level, of localization. Can you give us your thoughts really in terms of shifting power in the humanitarian system, and what would you like to see change from the perspective of your current role working in a local NGO? What steps would you like to see taken, and what would you like us to do as the Global Shelter Cluster to help that? So thanks very much to the 4 speakers. We've got the opening questions, and we'll look to the chat box shortly for additional questions. So I'll go back to Linda for some thoughts and a response on the question posed. So thanks very much, Linda.
Okay, thanks, Brett. So so sharing some thoughts on COVID-19. So as you know, it's 9 months since COVID appeared in all our the first alert and appeared in our lives, and we've learned an enormous amount, and there are certainly lessons learned that we can take moving forward. But in terms of the COVID response, the approach, the strategy, the public health strategy is pretty much the same. We need to suppress transmission. So that means, as we've discussed, ensuring that the built environment does not actually aggravate the transmission of COVID. We need to be able to provide appropriate clinical care, and the majority of clinical care for COVID happens at community and household level, so where the mild and moderate cases occur. But severe and critical cases do need more intensive care. So how do we provide safe health facilities, not only to protect their frontline workers, but also how do we ensure there's housing and health facilities that protect vulnerable populations? Now, there is no vaccine, and while there's lots of chats and vaccines and we're all hopeful, our only way forward at the minute is to apply the public health and social measures to the best of our ability. And that's the whole test, trace, isolate, and then treat. But feedback from our colleagues and surveys that we've done amongst health cluster partners and the coordinators demonstrate that implementing those public health and social measures are extremely challenging. And some of the examples are overcrowding of camps, whether that's in Iraq, Nigeria, Yemen, high density camps. So how do you decongest new camps and make shelter available for the existing population, but also for new arrivals? I mean, we've also been dealing with the ongoing displacement and refugee movements during this time as well. And how do you ensure that you're placing these people in appropriate shelter that does not add to the transmission of COVID? Even when we are doing contact tracing and identifying suspect cases or people with positive tests, and we're asking people to either isolate or quarantine, it's difficult to do that often in their household, particular household, to separate themselves from the rest of the household, because there is no space to do that. So does that mean that you just accept that transmission is going to take place in the household, or do we start building community-based isolation centres, which we have done, and I'm sure Said knows some of this. It's been happening in northwest Syria and elsewhere, but there's a shelter requirement there. And what do we do then where culturally people refuse to isolate, to physically separate, to isolate? We've seen this particularly in Iraq and Yemen. So how can we adapt household spaces to allow that separation to take place? The big thing our field teams faced was there was a lack of guidance on how to manage overcrowded shelters and dwellings in respect of this respiratory environment, and all credit to our respective colleagues who at the field level, always at the sharp end, came up with solutions. And I think this idea of innovation, not only the overall planning and strategy for this, including working with the CCM cluster, identifying new land, creating new isolation centres, but the innovation around the type of shelter that was used for that, but also innovation around community engagement and risk communication to gain public trust around issues of isolation, quarantine, and different types of shelter. So simple things like providing internet connections within camps, within shelters, to limit population movement. So there's a lot of stuff out there. I think, again, in terms of the treatment centres, the severe acute respiratory infection centres, the SARI centres, which are quite complex environments, having the shelter cluster work with us to either help us build new centres or adapt to existing health facilities to do that. So I think what we have are lots of experience, lots of lessons learned, some good examples, I would say, particularly from Iraq, Gaziantep, maybe Nigeria, where they have both health and shelter, and sometimes with WASH have developed outbreak preparedness and response plans. And I think we need to look at these, extract the kind of common learning from this and see how they can apply to other environments. But the innovation, and especially the speed to be able to innovate and adapt and maintain community trust and buy-in to, to uphold the public health and social measures is a critical thing, and highly complex, much more complex than it appears telling you now. So I think there are good opportunities there, but we need to be swift at capturing that for the rest of this pandemic, because right now that is our strategy moving forward. There is no alternative strategy to these public health and social measures right now. Thank you.
Great, thank you very much. Thanks, Linda. Great response. And I know that we've got some colleagues online from Iraq, and Gaziantep, and probably Nigeria as well. So I'd like to hear some of those examples too. Next, I'll hand over to Karima. If you can give me a couple of thoughts on the question posed. Thanks, Karima.
Thank you, Bryce. It's a very good question, and we've been talking about this humanitarian development nexus for the past probably decade. I think that the first thing is that we need to recognize the limits on each side of the spectrum. And so from the development side, which I can speak about more, is that we are not as fast as the humanitarian sector in terms of the quick response, the availability on the ground, and the support, the direct support to the households, which is very, very important during and immediately after a disaster or a conflict, or even during the conflict. That said, the forte of the development agencies is that they can scale up a lot of the and solve in a very systematic way and systemic way issues that deal with land, that deal with finance at a larger scale, that deal with costs of reconstruction, for example, and the availability of material at the market level, which, as you know, of course, but this is one of the biggest issues in Beirut, for example, for now. We can also influence and bring in and crowd in some of the private markets that could potentially support a sustainable reconstruction of the long term. And so one of the key elements is really recognizing the strengths and weaknesses of each one of the humanitarian and the development partners, and then ensure that there is a continuation of each one of the actors into the others' work. And so that is one of the things that we are trying to do in our post-conflict work, is really to work very closely with our UN colleagues, with the NGOs that are on the ground, to try to understand what it is that they are doing and how we can scale it up and build on it for long-term development. We also need a cross-fertilization of skills. We do quite a lot from the government side. We have quite a lot of engagement with these national level stakeholders. We have less so at the sub-national level. We go down sometimes to the municipalities as part of our urban work, but that is not enough. And so we do need the humanitarian agencies to support the development agencies in that regard and connect with the communities directly, especially in terms of the implementation. We have a track record success with our operations in Yemen, for example, working with the UN agencies in implementing critical urban services support that have been very, very instrumental to provide some of the basic services such as roads, such as solid waste management, electricity, basic health to the communities. And I think these are the key examples that we would need to bring in forward and look at and look how we can scale them up. The case of Yemen, for example, is more based on the urban services rather than the housing, because again, the housing is very complex, and particularly in urban areas where there's ownership disputes, heritage compliance, smaller plots, multiple ownership of land. And so this has, as I said, impact on the longer term policy, the longer term policy and planning of the sector. And so having this conversation early on, immediately after a disaster, when it's a disaster caused by a natural hazard or a conflict, and so engaging early on during the conflict would be very important. So yeah, in a sum, 2 points. One, really understanding the strengths and weaknesses of each side very clearly from both sides, and bringing in the two together throughout the processes of our work in better communications, fora like this, where the development agents really better understand how the humanitarian actors work, and vice versa. So that's it on that question. Thank you.
Great, thanks very much, Karima. Much appreciated. Great examples. We'll go on to Congresswoman Ramirez Sato for the response to the first question. Thank you very much.
Thank you for the question. In the past 20 years, I saw the positive change and improvement of people's attitude and action during times of disaster. The Super Typhoon Yolanda, which hit the Philippines in 2013, was the biggest wake-up call for all Filipinos. After this super typhoon, all the local government units, from the province, municipality, barangays, which is our smallest unit of government, the village, they came and organized Disaster Risk Reduction Council, which are actively participated in by all sectors of the community. And these councils passed their own disaster risk reduction management plan. And this management plan seeks to prevent new disaster risks reduce existing disaster risks, manage residual disaster risks, contributing to resilience and reduction of disaster losses. The local chief executives of all these government units are mandated by law to make sure that all the constituents in a particular territory must know and be apprised of all these management plans so that they would know what to do and how to react in times of emergency and disaster. One of the more important realizations I gathered over the years is that shelter and settlements planning in disaster risk reduction management must be done in full circle. It starts with a safe, reliable, and rapidly deployable shelter plan, which is the key feature in any disaster response program. And it should end with a safe, resilient settlement plans guided by science and evidence-based hazards and vulnerabilities studies. These safe and resilient settlement plans will ultimately reduce the risks to communities even before the disaster strikes. After the usual disaster response of providing emergency food, water, and temporary shelter, providing shelter will provide for a more organized and sustainable provision for food, water, health, and sanitation. And finally, an effective shelter plan must be able to provide its beneficiaries with an opportunity to transition to disaster rehabilitation and recovery. This entails grant of livelihood, healthcare, education, safety, and security. An effective and efficient shelter plan can develop into a safe, sustainable settlement that effectively comes into a full circle. Thank you.
Thank you very much, Congresswoman. Much appreciated. I highlighted two of the main points of your answer there, really around the effectiveness after Haiyan, Yolanda, of these local DRR community groups, these councils, and how at barangay level. And also the importance of having these shelter and settlement plans, safe, resilient shelter and settlement plans at that local level. So this points to the question of localization, which is what we will have Saeed also respond to. Really, what's his perspective on what we should be doing different at headquarters and different at the cluster level to better support local organisations, for example, like the one that he's working in, doing cross-border work into northwest Syria. So we look forward to your response. Thank you, Saeed.
Thank you very much. Let me be a little bit direct at the beginning. At the beginning of the Syrian crisis, since 2013, 2012, there was initiatives, there was a local NGOs who start reforming and start building their own self and start supporting the affected people. And then to complete the circle, the donors came to an international NGOs based on Gaziantep, on Beirut, on Erbil, on several places. And then through and among those international NGOs, they were implementing the response or replying to the response accordingly. Now, through the 7 years, actually, we didn't have any kind of capacity building as we are a local and national societies and non-governmental organizations. The basic point is we still, through the 7 years, complying to the or complying to the donors regulation, complying to the or adapting the partners standards and etc. And it was only emergency response. How can we reply to that within our current context? And because it's a political context, it's a political character in Syria. How can we, as local initiatives and local NGOs, act as humanitarian workers, not as something related to politics or despite any arguments outside. How can we apply our work as real humanitarian workers, referring to neutrality, referring to even there is some good point to raise here, the house land property issues that we are facing among all of Syria. In all the controlled areas of Syria, there is a serious issue that beneficiaries and people of concern cannot access their own documents of housing and land property. How can we as an organizations build our own knowledge and have this knowledge? How can donors and headquarters support us to have this knowledge about, as example, Pinero principles, the international humanitarian law, to meet those societies' needs? This is our basic concern. The main challenge here, the biggest challenge here is since 7 years, we are always and only meeting the donors' requirements, the donors' regulations, and implement on ground, implement only emergency response. How can we move to the Nexus approach, as my fellow mentioned? How can we move to more durable solutions? How can we not institutions that are affected by political points of view or affected by any kind of the context conditions? This is our biggest challenge here, and what we expect from donors is to give this support more to the capacity building of those organizations, to make those organizations stand up on their own and act on their own regulations and act on their own procedures and meet the people's real needs and communicate with people. That's it. Thank you very much.
Thank you very much, Said. So now I'll turn over to the questions in the chat box, and I'll pose the questions to our speakers. And then I'd like to invite anybody online to speak up and ask some questions, and we'll have a conversation around that. So I'll first of all read out some of the specific questions per speaker, and you can answer those in order. And then after that, we'll open up for a broad question and answer. So the first question is for Congresswoman, and really around the role of the private sector, that they're taking part in responses, and what's your experience about working with the private sector, and how can government better engage the private sector in disaster response? There's a second question for the Congresswoman, but I'll just bypass that for the time being. I can see a question from Renee from the Shelter Cluster for Said. What do you think that people in headquarters can do? So as a global community, what should we do better to support the shift from emergency shelter to more durable solutions? We know that you mentioned the donor conditions there, but what other kind of resources do you think could be required? I mean, apart from what you mentioned on training as well. And then I'll invite you all to address, as you wish, the question from Ella, my co-lead in the cluster, and it's a great question and very true. So shelter and settlement sector regularly suffers from misunderstandings such as it's too expensive, or the word shelter is a bit unclear. And I know that, you know, Karima, we discussed that in urban, really talking about housing. So if you had suggestions for us to increase the visibility or the effectiveness of the sector, what would that be? So some thoughts to our panelists. And apart from that, I'll also invite for all the participants online, anybody, you're welcome to speak up, raise questions, and we can take it from there. So I'd like to invite the panelists to speak really on those questions broadly, and maybe I'll ask the Congresswoman to speak first and then other panelists to follow. Thank you.
Yes, in disaster risk reduction management plans, the government or the Philippine government has embarked on an all-nation approach so that all sectors have been encouraged and invited to participate in all the plans for disaster rehabilitation and recovery. in particular, the Philippine Red Cross and other civic organizations in the Philippines have always been the first responders in times of disaster and calamities. They would be the first to distribute food packs. They would be the first to go to devastated areas and help in the evacuation of affected families. Thus, the government has also engaged the private sectors from the start of planning for disaster risk reduction management up to the implementation and up to the recovery of the affected families. So it will always be a whole of nation approach. No sector will be left without any participation in all our efforts. And one of the challenges that the local government units faces in addressing these shelter problems is the lack of financing. And this is where the private sector initiatives or cooperation is most needed. Under the local government code in the Philippines, the local government units are mandated to allocate 5% of their annual budget for their calamity fund. And 70% of this 5% is allocated for mitigation and preparedness, and 30% for quick response on calamities. For small and poor local government units, 5% is a very small amount, and these cannot shoulder or cover the expenses for shelter assistance, so that the local government units would always look up to the national government for shelter assistance programs. And again, as I've said, this is where private initiatives and private cooperation are most needed.
Thank you very much, Congresswoman. I might ask Said to answer the next question, and then also Karima, if you can respond to the question around the terminology and what can be done. It's there in the chat box. Linda, my apologies, I forgot to mention there was a question from Bill Flynn from CARE, and he's mentioning that we all tend to work in silos. There's recently been a lot of discussion around forming some kind of health wash shelter intercluster working group. That might be related to also the issues you raised in terms of your observations on COVID and the relationship between health and shelter. Do you think that's a possibility, and what could we do to make it happen? Thanks, Linda. So I'll hand over to Said, and then Karima, and then Linda. Thanks very much.
Okay, thank you very much. Let's say, replying to the what can we as HQ based to affect or to support. Let's say the basic thing that we have here, the basic challenge, is we didn't have, as example, any capacity building on how to support people, how to deal with people directly. The only concern was for donors, I'm talking, is to deliver the assistance. Now, if we need to search for more durable shelter solutions, as example, the brick houses, the prefabricated units, any other thing, how can we deal with that? We don't have any terms of reference. We don't have any, let's say, standard operational procedures to provide this assistance. How can we receive the capacity building to make our own, let's say, communication with people? How can we make our own choices as Syrian internally displaced people, and to have either this better shelter or more durable shelter solutions, or to have the cash-based intervention? How can we provide, what can we provide as a capacity building to the Syrian local organizations so they can act not only on the regulations and the standards of donors and how to spend the fund and how to run for the money, It is how to make yourself more accepted by those people, and how to support the affected society itself. It is basically, we had trainings and lately on Gaziantep, as example, on site planning and how to establish IDP camps, how to establish water drainage networks, how to study the topographic slopes, and etc. And it was very useful. Actually, my brain is it's 2020. We had to take this 2013 or even after that. Also, we had the trainings on house land property, how to deal with these documents if it's missing. Actually, it was provided by Shelter Cluster, of course, but no one is keep working with those regulations. No one, only we are taking this capacity building as an extra working hours and take it and then go back to house. How can we build Assyrian organizations? Because I believe our basic target here is we have to build sustainable organizations which is accepted as a humanitarian organizations and also as accepted as a humanitarian workers among the community. Sorry. So we need that kind of support. How to build our own TORs, standard operation procedures, risk management matrices, and studies, not copy pasting another people's text and paste it onto our proposals and do it. This is our basic challenge and our basic thing. Another question from Ila is the definition of shelter and the misunderstanding of shelter, if I may answer for that. Okay, with each context you have, as example for Syria. For Syria, people need houses. So only some small organizations are implementing brick houses. We are not allowed to do that yet because it's an emergency response. The people understand that the word shelter is let's say it's an intersectoral collective efforts. We have within the shelter, we have to provide the safe water, the food, the good health conditions. This all theoretical, okay, but actually on the ground we are not providing that. We are yet still providing tents, as example, because of the context, still providing some temporary shelter solutions. So actually even the people on the ground are confused about what kind of service can we provide. This is our biggest challenge here in cross-border activities. Thank you very much.
Said, I might take the liberty as moderator to follow up on one of the comments you just said then. It struck me. When we're talking about localization, there seems to be this mentality from Geneva or from the clusters of we work and then, you know, exchange power, relinquish power, let's say, to local agencies and local organizations to do things in the way they want. But what you brought up then was actually an interesting conundrum. It's one thing to do that, but on the other hand, there's still a lot of donors that won't let you do anything differently anyway. They won't let you move into permanent shelter. They want to maintain funding only for humanitarian response, but nothing more. So the possibilities of what you can do with more power and more money are actually limited, especially when you don't have a lot of the systems in place. So rather than relying on, say, global humanitarian agencies to train and capacity build, is it also a bottom-up approach as well? What else can happen at that local level? I mean, when you're speaking about HLP, that's a very top-down approach to the division or understanding of land and property and legal issues. But there must be other locally negotiated ways of understanding without relying on too much top-down information. So maybe just your thoughts on that, to have more of a bottom-up approach and not just a top-down approach to localization. Thank you.
Thank you very much.
If I may jump in here also, just because this is an important thing. And Saeed, I really take your point about the fact that it is you are acting in a protracted conflict, which is very, very different from your classic humanitarian work that we do generally within a time span of like less than a year, and then we're done and we do that. So even the capacity of the humanitarian workers to work in a long period of time doing exactly the same thing in the same context really needs to be rethought. And you guys are breaking new ground as you go. And so I think that this is something also to be taken into account, and really thinking a little bit creatively about what are the things that you can learn from the humanitarian agencies that have developed a lot of their work based on immediate, especially when it comes to shelter. It's really the best practices come from post-disaster. And how do you apply them in a protracted conflict that is ongoing? And so this is really a major challenge, and it's a question that I think we all collectively need to think through as well. Also from a development perspective, we think that this is also something that's really need to be, from our side, we need to start thinking about it in the sense of how do we better engage in protracted conflict and not wait until the conflict is over. And so this is also, I feel like it's a debate for a whole hour just for this specific point.
Yeah. Thank you very much. Yeah, it's indeed, it's a specific point that if we may call it trust, because donors usually do not trust local NGOs everywhere. So they trust only international. I'm not here pointing to any international organizations, but I want to make that even us, we need to deliver this support. And I'm not speaking here about fund or about kind of money. We need here to deliver this support directly to the affected communities, not through donors and partners and implementing partners and subcontractors. And thank you very much, indeed.
Thanks, Said. Maybe Linda, I might get your response on the question around this kind of essential critical cooperation between WASH, health and shelter. And I think that we'll just leave the cameras on for the speakers, and then anyone of the audience or anyone online, please put your camera on and you're welcome to ask questions as well, and we can make it more conversational. Thanks, Linda.
Thanks, Brett. Yeah, so Bill's question, and I see a similar question from Charles from Oxford Brookes. I mean, the answer is yes, absolutely. We should be coming together more to do that. And I think within our respective discussions we've had over quite some time, there is an interest to do that. Often it's the capacity and the incentive to do it. I said in my opening remarks that COVID in some ways is acting as a catalyst for that. And I would say it's probably the strongest engagement we've had with particularly shelter and CCM and health for some time. We have examples of health and WASH cluster, health and protection cluster, and the various ARs collaborating together to come up with what we call either joint operational frameworks or common strategy or strategies for common response scenarios. And I would argue that's obviously something that probably health and WASH and shelter should be doing. So, you know, if you've got a spare moment, Brett, I'm sure we can fit it into our work plans, but definitely a conversation that would take place. And the important thing about these initiatives is they should be very country driven as well. Any working group that's created should have a strong country presence to get that practical experience informing that discussion. But yes, we're very open to the idea. Thanks.
Thanks very much, Linda. Karima, maybe your thoughts too on that issue of shelter and terminology. The question that was partially answered also by Saeed, the one asked by Ella. And then I want to even link back on this localization issue around donor trust as well. I think is very interesting. So Karima, your thoughts on that, please.
Thank you, Brett. So listen, I think that shelter again is a very, very valid terminology for a very short period of time. Does not necessarily apply to urban areas, as we have found out as well in the case of our latest engagement in Beirut. In a very dense urban area, often in the very humanitarian immediate kind of weeks after a disaster, you find that there are different solutions than just what the term shelter evokes in people's minds, which is four walls in a roof somewhere in a campsite near an airport, like what was used to be the case in Port-au-Prince, for example. Rather, there are very different forms of that, and I think that one, we may need to start thinking a little bit as part of that continuum, trying to think about a housing solution rather than just a shelter, to be able to really benefit from everything that the humanitarian actors do to make sustainable housing opportunities for people, because these are what the where the economic opportunity for household comes in, because that becomes an asset.
Karima,
yeah,
I'll stop you there. Would you suggest or propose that we should change the word or the name to housing, especially when we're dealing in urban areas? Or how would you see that?
My inclination would be to do that, particularly in housing in urban areas, because it also sends the signal that we are here to support for the longer term engagement in the sector, not just a very short period of time, which is again controversial. And I do understand that I am coming from a development perspective, but just thinking about all of the investment and the effort that is being poured into supporting households accessing adequate shelter. But the main purpose of it and the main benefit of it is that for the long term, they have an asset that they will be able to benefit from and economically use as a way to step out of poverty. And so I think that would be a way for us to look at it, particularly in terms of urban recovery rather than rural recovery. And in rural recovery, it's fairly easy because we have that flexibility to be able to be put in discuss shelter and then discuss housing reconstruction. And that would be two separate things. But in urban areas, that becomes a little bit more complex. When we start talking about housing rather than shelter, we fully engage in the complexities that come with the sector. So we discuss land rights, we discuss planning, urban planning, policy, municipal services. We discuss obviously the WASH and urban services that come with it, but we do know full on what we are really talking about when we engage with people that are not from the sector, that are not shelter specialists, what it is that we would like to talk about. So that is a little bit my perspective on this point. When it comes to the local NGOs engagement, I fully hear you. That is a real issue. From a development perspective, we are, as I mentioned at the beginning of my introductory remarks, we tend to work with the government through the government. We do a lot of capacity building with NGOs, usually, but that comes in tandem with governments. And so in some situations, it becomes a little bit more difficult than others. That's it on my end.
Sorry, I was on mute. I said thanks, Karima. That's much appreciated. I can imagine too the difference in natural disaster contexts where people are not necessarily displaced and it's really in situ recovery process versus conflict. And I know we did discuss that in a previous last week or the week before. The real complexities of working in conflict contexts, especially when it's refugee, really hard to get these durable solutions. Angel, you've got your hand up. Did you want to ask a question, please?
More than a question, is a comment to add to the issue of localization. And I think the generic problem, and this is not unique to Syria, but I think is a global issue, is the misunderstanding there is about capacity building. For example, local organizations tend to be partners of international NGOs or UN agencies. And what they consider capacity building is, I tell you how to implement my SOPs, I tell you how you have to do recruitment, I tell you how you have to do financial management. And then local NGOs that have to work with multiple international partners, then have to work in 10 different ways to match those of their international partners, rather than having a specific capacity building that is for the local organizations to do these things by themselves and to be capacitated in this, and not as per the order of international NGOs. Basically, what is happening is that they act as contractor implementers rather than actual partners, and this is one failure that we really need to fix. And I guess that's what Said was saying earlier, and we need to really find a way of overcoming this challenge. Thank you.
No, great point on health. I really agree with you. It really is about transposing at the moment rules and regulations onto local agencies, and that's not localization. That's really just risk transfer and mitigation, isn't it? There's a comment there also from Marta. How about using the word accommodation as opposed to shelter or housing? Is that a nice connective word that describes the situation we're talking about a bit better?
That could be.
Yeah, please, Karima, go ahead.
That could be something that we could potentially look into. Again, it's more about a marketing sort of a campaign that we need to do as shelter specialists to really fully get everybody on board, particularly the donors, about what is it that we mean whenever we use any word it is. And so when we talk about accommodation, again, are we talking about all the complex issues that we would be addressing in shelter? Because it's the most complex sector after a disaster or during a conflict that needs to be addressed. And so we need, on our part, to better communicate what it is exactly that we would be addressing in our intervention. Accommodation, again, I have nothing against it. I'm noting also that there is a conversation about settlements. I know that there are coalitions of international NGOs that are talking about urban settlements as part of the urban recovery framework that is being worked on right now between the World Bank and also UN Habitat. So this is also something that we could start thinking about if we don't want to specifically just talk about housing in urban areas and talk about urban recovery. But these are different options, and I think the debate needs to be had in a more consistent manner to be able to reach a terminology that is clear and convincing enough to donors to be able to have the space for us to intervene in all of the spectrum of issues within one sector that we would like to talk about.
No, thanks, Karima. That's a really valid point. I also note there from Miriam, there's a session coming up. You can see it on October the 27th, another one of the sessions this month, looking at homes and communities. I know that that's terminology that some of our partners use, for example, CRS, NRC, not so much shelter, but really more homes and communities. So that really talks about this bridging that nexus divide and making it look at this area-based understanding. I think that we're nearly at the end of our discussion. I think just when people are getting into the issue, I can see something from Lilia as well, that there's some guidance being developed for Latin America around COVID-19 shelter cluster that'll be available soon. That's really good news. I can see from Bill, you said you totally agree with Karima on the issue. Accommodation ignores health, livelihoods, protection, security and home. Very good point. I can see Charles as well from Oxford Brooks. Long-term linkages, yes, on the 28th. So that's very important. Now, I think we're basically at the end of the session. I really thank our panelists for giving their time, giving their thoughts. I think these kinds of sessions are fascinating. They're certainly a little harder to do online than face-to-face when we're all in the same room and we can start yelling over each other. But nevertheless, being able to do it online was a good opportunity as well, because we do have more people that can participate. Any final thoughts? I welcome Linda, Said, Congresswoman and Karima. If there's any kind of 10 or 20 second last thought that you would like the audience and all of us to keep in memory, or anything that you feel that you did not quite emphasize as yet, please welcome your final thoughts. Linda, if you'd like to begin, or Said, anyone, you're welcome.
Thanks, Brett. Look, just to reiterate what I've said, I think we have a momentum. I think that we clearly understand that we have a shared interest in this whole issue, and there's a momentum. The issue really is to keep that going now and really capture the good experience that we have already, and then further build on that. So let's get the conversation going. And thanks to everybody. It's been super interesting for me as well. Thanks.
No, thanks, Linda. And I think with COVID, we've really opened the door on a whole different series of collaborations within the cluster. It's been really evident in the last 6 months. So yes, let's capitalise on that. I know Ella and I are keen to do so. So thanks very much. Said, any final thoughts from your side? You know, your feeling on the ground there. What final remark would you like to provide? Thank you.
Thank you very much for that. Just to mention on something that I see from my own perspective within the Syrian context, shelter cluster may lead or may have or shall have even later the leading part of other clusters, because we are interfering in a lot of sectors, in health, in food, in water, and I believe even about the name it was called as example within ICRC as well, water and habitat. So it's not about the wood, it's about what are we doing to people. We have the biggest responsibility for that, and I hope we can meet this. Thank you very much for allowing me to deliver this idea. Thank you very much.
Thank you, Said. It's been a pleasure having you. Really valuable, and thanks for your comments. Congresswoman Sato, are there any final thoughts you'd like to share? Any remarks or points?
Yeah, thank you very much. First of all, thank you very much for having me in this conversation. As Linda said, this is a concern of everybody, not only from the Philippine side, but the whole world has a concern on shelter, on settlement, on disaster risk reduction management. So let us keep the conversation going. Thank you very much.
Thank you very much, Congresswoman. Much appreciated. And Karima, any thoughts or final points you'd like to make from your side? Thank you.
Thank you, Brett. No, this has been really wonderful. Thank you for allowing me to participate and present the perspective of the development side of things. This is definitely just the beginning of a conversation for us, and I feel like we need to really deepen the conversation, particularly when it comes to urban areas. Thank you very much and have a good day.
Great. Well, thanks very much, Karima. And thanks again to Linda, to Said, to Congresswoman Sato, to Karima, and to everyone that participated and posed questions and contributed to the discussion. I mean, it's been very well rounded. We've looked at development and humanitarian development connection. We've looked at intercluster, really specifically around the relationship between health and shelter of COVID-19. We've looked at local issues from this localization perspective in Gaziantep and Syria cross-border, and some of the critical things there around agency and empowerment of local actors who are really delivering the services, and also from the perspective of the Philippines as well, from Congresswoman there, around the relationship with the government and local actors, private sector, and disaster risk response. So it's been very broad. Much appreciated to you all, and thanks for sharing your expertise and your thoughts. And thanks to everyone online. Have a good afternoon, and we'll all keep working on these issues. Thanks very much.
Thank you.